TomoTherapy gives a lot of flexibility in terms of the radiation oncologist in delivering the treatment and sparing normal organs. So one thing we found when we started using the TomoTherapy was that it was really doing an excellent job with complicated breast cancer patients.
It's very comforting to know that I am, in a place that's got this great equipment and that it's what is going to be treating me.
Oftentimes when you're treating more advanced breast cancers, you have to treat not only the breast but the axilla, the lymph nodes under the arm, and also the lymph node above the clavicle. The TomoTherapy system can do this with no complicated matches, i.e. you could do it in one treatment field.
Experience of doing radiation for 33 days, I knew pretty much when I met with the medical oncologist that this was how long it was going to be. Day one was sort of revealing. They fit you with a cradle that sort of is something that you lie in when you're in the equipment. And so you slide in and they scan and then you slide out. And then I guess they compare that scan with sort of the model that they want to radiate you. So it's great that they're being so thorough and careful.
We use CT guidance for every patient before every treatment each day. The patient comes into the room and is positioned with tattoos, which is the traditional way of positioning, but then we do a quick CT scan to determine their exact location and we shift if needed. So because we have image guidance, we feel more confident in the setup, which means that we can now start to reduce the safety margin that's given around a tumor with radiation. So we can make the treatment margins smaller, which means a less dose to normal organs and normal structures.
I don't feel any fatigue yet. I think, the doctors were saying probably it could be like even into the 3rd or 4th week that maybe I'll start feeling the fatigue. There's a possibility of some kind of redness, and I have noticed that that breast is pinker than the other one.
As the field of radiation oncology has developed and been refined, more and more studies have been coming out looking at the long-term effects of radiation. But we know from all of these studies that the more modern techniques that are used, such as TomoTherapy, where you're minimizing normal dose to organs like the lung and heart, do relate to having a lower chance of side effects in the future.
So, to be able to be involved with treatment that's on the leading edge of technology, is comforting, because at this point I'm just wanting this last step of the journey to be done and to be able to kind of put it behind me. And obviously, I'll have more frequent mammograms and checkups over the next couple of years, I hear, just to make sure that, there isn't any reoccurrence. And, I'm very optimistic and look forward to, those clean reports and none of those darn phone calls saying, oh, can you come back in for another look?